Breaking news tonight, the deadliest day yet of the coronavirus outbreak in the U.S. Over 200 dead in 24 hours. New York City, now the nation's epicenter. Long lines at hospitals, makeshift morgues being arranged. U.S. cases surging to over 60,000. The new hotspots cropping up. Deaths rising in New Orleans. Is Mardi Gras to blame? While Florida and other states won't issue stay-at-home orders. Also, hospitals under siege, many already at capacity. Inside the secret stockpile one top hospital tapped into. And a growing number banning visitors, with more pregnant women considering home births. The risks you need to know. The Senate deal for the largest relief package in U.S. history. What's in it? And what's the quickest way to get your check? And the late word tonight from the White House after the president said he wanted to reopen the economy by Easter. And will the relief package be enough to rescue businesses? Unemployment skyrocketing. New safety measures at grocery stores as some are forced to shut down. The new warning about defying orders to avoid large gatherings.
God gave you a brain and expects you to use the intelligence that you are given.
The pastor with an urgent plea and the new treatment that could save patients in critical condition.
This is NBC Nightly News with Lester Holt.
Good evening, everyone. I hope you're watching us safe and at home. Here in New York, the current American epicenter of this pandemic, the first data tonight suggesting that maybe, just maybe, social distancing is helping to slow the onslaught of coronavirus. And yet officials say the worst days are still to come. The numbers are still rising, leaving the region's medical system on the edge of being overwhelmed, and other cities fearing they may very well be next. We've got it all covered. Miguel Almaguer starts us off.
As our country faces a national emergency and scenes like these unfold in communities big and small, tonight New York State says it's the canary in the coal mine. Once bustling city streets have become eerily quiet, while lines outside hospitals stretch around the block. Makeshift morgues are being prepared. The governor says in 3 weeks, coronavirus cases will hit their high point.
We still have the trajectory going up, 80% still self-resolved. About 15% of the people who test positive require hospitalization.
While the explosion of new cases in New York are slowing, the city's high density and residents leaving town could exacerbate the spread.
Keep a safe distance of 6 feet from others.
Police are warning residents to avoid crowds. Some city streets will be closed to traffic so pedestrians can spread out. Across the country in California, where half as many tests have been taken than New York, the death toll and those infected could easily become the highest in the nation.
We are anywhere from about 6 to 12 days behind what we are seeing in New York City.
Even in our country's most remote state, Hawaii, there is trouble in paradise as new cases skyrocket. More than half the nation has orders for residents to stay home. But some governors, like Florida's, will not issue a state mandate.
To order someone not to be able to earn a paycheck, that is something that I think is inappropriate.
But the World Health Organization says staying at home is vital.
Lockdowns slow down a virus like this. You have got to find those transmission chains, cut them to actually stop it.
Tonight in Louisiana, where the virus is spreading faster than anywhere else in the world, hospitals describe their fight against the illness as a war zone. Our Blaine Alexander is in New Orleans.
Today, Bourbon Street is practically a ghost town, but exactly 1 month ago, more than 1 million people packed here for Mardi Gras. And experts say that is a big reason that numbers here are growing faster than almost anywhere in the world.
The crisis around the globe is grim. While Italy has the highest death toll, over 6,800, Spain has now surpassed China, 700 dead overnight. And just today, word that 71-year-old Prince Charles tested positive for the virus, but has not been hospitalized.
We thought she just maybe had the flu or had a bad cough.
In St. Louis, all 5 members of the Winehouse family contracted the virus. Mom Jane needed a ventilator to keep her alive.
No health issues in her past, no pre-existing conditions whatsoever.
With this California doctor living in a tent outside his home to limit exposure to his family, it's another example of sacrifice as every American faces the same threat tonight.
In cities like New York, social distancing appears to be working, with the number of new cases slowing. That is offering a glimmer of hope. Meantime, here in Los Angeles, we're told the order to stay away from crowds could last as long as 2 months. But Lester, we should point out the vast majority of Americans who get sick do not need to go to the hospital. Lester?
Important to keep in mind. Miguel, thank you. This extraordinary crisis certainly leading to some extraordinary calls to action. For example, New York University graduating some of its medical students early so they can join the battle as more hospitals around the country are besieged. Here's Tom Costello.
From the doctors on the front lines, a sobering reality check on the pandemic. Desperate for supplies, New Jersey doctor Alexander Salerno has set up triage tents to handle 300 patients a day and spent $17,000 buying supplies on the black market at an 800% markup.
They open up the warehouse and you see pallets upon pallets of equipments, gowns, N95 masks, Purell hand sanitizers, Clorox wipes. It's insane. And I'm like, there's no moral compass.
At Brigham and Women's Hospital in Boston, critical care doctor Daniela Lamas knows the devastating impact of not allowing visitors to the hospital.
I'm worried about my patients taking their last breaths alone. I worry about this at the same time that I acknowledge that this is actually what we must do in today's climate with this illness.
At New York Metropolitan Hospital in Harlem, a surge in young patients on ventilators struggling to breathe.
At the present time, we have an adequate number, but the patients that are requiring the ventilator are increasing with each day, and I will need more mechanical ventilators.
New York Governor Cuomo again reiterating his hospitals are in immediate need of ventilators, urging other states to share theirs and promising to reciprocate as the virus rolls across the country.
We're asking for their help and their consideration, and we will repay it with dividends.
Other cities are already feeling the heat. Hospitals in Atlanta and Detroit say they're full. Illinois' governor warns in a worst-case scenario, he'll need another 9,000 ICU beds and 5,000 ventilators by April 6th, double what he has now. NBC's Morgan Chesky is in Miami.
Doctors here in Florida say the low number of confirmed cases does not reflect reality, and that's why this field hospital is being built to accommodate an expected surge of COVID-19 patients.
Meanwhile, at Unshattered, an addiction recovery nonprofit in upstate New York, they're working round the clock, making masks for local medical workers.
We anticipate being able to make about 1,500 masks per week, but we know that we cannot meet this shortage.
One more note, the nation's VA hospitals also say they're seeing older COVID-19 patients, but they insist they're also ready with masks and ventilators. Lester?
All right, Tom, thanks. A health crisis and, of course, a financial one. The economic impact. So many people anticipating that massive emergency aid bill that includes direct payments to most Americans. But tonight, the bill has still not been passed. Peter Alexander has late details for us.
Tonight, the largest economic relief package in U.S. history, more than $2 trillion worth, is expected to get the Senate's green light, despite some last-minute drama.
This is not even a stimulus package. It is emergency relief.
First up, those direct payments to most Americans. For people making up to $75,000 a year, a $1,200 check. Couples making up to $150,000 would get $2,400, plus an additional $500 per child. Next, unemployment benefits rising by $600 a week for up to 4 months, now expanded to include gig economy workers and freelancers. Small businesses also getting a boost. Forgivable loans up to $10 million to keep paying their employees. Also in the deal, $500 billion for corporations like airlines, including new rules on oversight and a ban on stock buybacks. And more than $100 billion for hospitals. New York Governor Andrew Cuomo saying his state that's been hardest hit will get $3 billion, what he says is not nearly enough.
That is a drop in the bucket as to need.
Overnight, new reaction to the president's suggestion that he'd love to have the U.S. opened up by Easter.
We're going to look at it. We'll only do it if it's good, and maybe we do sections of the country.
His top public health advisor, who's warned the outbreak will likely last well past then, calling the president's timeline an aspirational goal.
He's been very flexible about it. Even though it looks like he's made this absolute decision on something, he does have an open mind about it.
That drama over the bill, a clash over unemployment insurance that still needs to be settled before it goes to the House. The president saying he'll sign it immediately. And as for those checks, you could get them faster if you have direct deposit with the IRS. If not, it could be more than a month by mail. Lester?
All right, Peter, thank you. And that new stimulus package includes hundreds of billions of dollars for small businesses. But will that be enough? Many workers resorting now to desperate measures to get by. Our Gabe Gutierrez reports.
Tomorrow, new national unemployment numbers are expected to shock the system. Likely millions of Americans, like Cheryl Swanson, are filing claims for the first time.
It's a new reality that none of us really know how to deal with.
Laid off from a restaurant in Colorado, she says it took her 6 days to file her claim.
It was next to impossible. A lot of my coworkers didn't even try because they could tell from all of us that it was just maddening.
GoFundMe is launching a small business relief initiative where people can donate online. Across America, the great adaptation is underway. Businesses are getting creative to survive.
Big breath in.
Yoga studios teaching down dog online. Electricians in San Francisco using their vans to deliver groceries.
I think our guys are enthusiastic about it.
From Chicago to Omaha, distilleries now brewing hand sanitizer.
We'll form an assembly line and crank as many out as we can.
But now new concerns about the workforce still on the job. Less than a week after Amazon announced it was hiring 100,000 new employees to meet surging demand for home deliveries, workers in at least 6 of its warehouses have tested positive for COVID-19. And with customers packing grocery stores and pharmacies, employees there are on alert.
It's a chance that I'm willing to take and my crew's willing to take and serve the community.
In some cases, the line for groceries stretches around the block. Some other stores here in the New York area have had to temporarily close after employees tested positive for the virus. Lester?
All right, Gabe, thank you. We'll be back in 60 seconds with an inside look at a hospital pushed to the brink. As the U.S. healthcare system is pushed to its limits, one top hospital has now been forced to dip into the secret stockpile we first showed you earlier this month. Stephanie Gosk takes us inside.
Boston's Mass General was planning for all scenarios, hoping it wouldn't be this one. Coronavirus cases doubling roughly every 2 to 3 days.
I would say this is following our worst case scenario in terms of pace, in terms of how fast this is evolving.
How much transmission has been out there that we're not aware of?
Just 3 weeks ago, they gave us an inside look at their pandemic plan, including a tour of the hospital's own emergency stockpile.
This looks like a lot of stuff to me, but how long is this going to last?
The goal was to give us about a 2-week buffer.
2 weeks?
2 weeks.
That's not a lot of time.
It's not a lot of time.
And now the stark reality. Mass General has already tapped into their emergency supplies, masks, sanitizer, and face shields. The federal government has yet to fill any of their requests.
We're trying, of course, not to use it all right now. We think we are still several weeks away from the potential peak of the outbreak.
The hospital has 150 critical care beds. They are scrambling to increase capacity by turning other units into ICUs.
We can get up to about 300 or so with the extraordinary efforts we've taken.
And then there are the ventilators.
We've identified more than 200 additional ventilators that we're looking to bring on board.
But if they run out, the hospital has a last resort plan.
We can actually take the tip of this and put it on a T-piece to connect it to 2 people if we had to.
People can actually share this?
They can share it in very rare circumstances. We do not do this normally.
Because normally a hospital like Mass General doesn't run out of the supplies critical to saving lives and protecting the staff.
The reality is right now the supply chain just can't keep up with our needs.
And every day, those needs are growing. Stephanie Gosk, NBC News.
A growing number of hospitals are imposing strict measures on who they are letting in their doors, and it's causing anxiety for pregnant women. Here's Katie Beck.
At 8 months pregnant, Carly Bertolino lives in constant fear of contracting COVID-19.
It's a horrible time for all pregnant ladies.
This week, more worry. News from her doctor that she may have to give birth to her first child without her husband in the delivery room.
You picture this milestone since you're a little girl. And not having my husband there potentially it's heartbreaking.
Hospitals across the country drafting new standards to restrict the number of people allowed inside delivery rooms, even limiting the number of in-person prenatal checkups. Several hospitals in New York banning spouses and partners entirely. The anxiety now driving many pregnant women to explore delivering at home or in a birth center.
We're getting swamped.
Calls to midwife Karina Hassel surging.
Every day, all day, into the night, of women asking if they're appropriate candidates for out-of-hospital birth and if we have space.
While giving birth at home may reduce chances of a COVID-19 exposure, the decision to have a baby outside of a medical facility presents a whole new set of risks.
That includes an increased risk for perinatal death, as well as potential neurologic problems with the baby.
And despite the increased demand for home birth, not every woman is a safe candidate for it.
You don't want a midwife who's taking everybody at every cost. This is not the time for us to lower our risk standards.
Still, for Bertolino, the current standard's hard to accept.
Emotionally, and you want your husband to be there if, God forbid, anything happens.
Weighing the new complications of pregnancy, birth during a pandemic. Katie Beck, NBC News.
By now, we've all heard the social distancing guidelines. The vast majority of houses of worship are abiding, but there's an important message tonight for those that are not. Here's Cynthia McFadden.
So many things we never thought we'd see. The Pope watching over an empty St. Peter's Square. Drive-up confessions in Draper, Utah.
The sacrament doesn't change.
Shabbat Shalom. Shabbat services live streamed all over the country. In Jerusalem, the iconic gold dome of the Rock shuttered. But not all religious leaders are on the same page. In Louisiana, a pastor has continued services despite a state order banning gatherings over 50.
We've heard reports from all over the country of some people of faith who say, listen, I don't have to socially isolate. I don't have to stay home. You know, God is going to protect me. What do you say to them?
That's nuts. That's crazy. Let me just say that. That's dumb. It's unbiblical, and it doesn't make sense.
Rick Warren, the pastor of the Saddleback Church with 30,000 Sunday congregants around the world, has never minced words.
God gave you a brain, and he's not going to write it in the sky. He gave you a brain, and he expects you to use the intelligence that you were given.
Warren and his wife, Kay, started Saddleback 40 years ago.
Thanks for meeting in small groups this week.
They've moved their ministry online.
Everything around me can be shaken, but God cannot be shaken.
Does that mean God will protect and heal?
I'm the healed and the devil's trying to give me the flu.
As a Texas evangelical preaches?
Put your hand on that television set.
That's just not faith. That's presumption. God is not a genie. He doesn't serve me. I serve him.
A priest in Grand Rapids serving by populating the pews with photos of those worshiping at home.
Looking at faces, it really took on a whole new meaning for me. It was really profound.
Keeping the faith and passing it on.
This is a time actually for churches to shine and to help the vulnerable.
Cynthia McFadden, NBC News.
And up next, the new hope for critical patients. All right, welcome back. Joining us now is our medical correspondent, Dr. John Torres. John, I know the FDA is allowing a treatment that essentially uses the blood of people who've recovered from the virus to help others. Exactly how does this work?
So, Lester, it's called convalescent plasma, and it's been used in past pandemics. The idea is when a patient recovers from coronavirus, their blood has antibodies that can be used on a patient that's currently infected. This is not FDA approved, but they are allowing doctors to use it on a case-by-case basis, but only for the sickest patients. It's not a cure, but it's a therapy that can be used in the interim while we wait for medicines to be approved in the next 3 to 4 months, and a vaccine, hopefully in a year. Mount Sinai Hospital here in New York is telling me they plan to start using this treatment in the next few weeks.
All right, good to hear. All right, thanks, John. Up next, the power of making people smile. Finally, Kristen Dahlgren and how some kids are bringing a smile to people feeling vulnerable and alone.
At a time when many are feeling helpless, some Long Island kids are doing all they can to help.
Hi everyone, I hope you're doing well.
and I will be singing Somewhere Over the Rainbow.
Transporting local senior citizens on lockdown to a happier place. Sending videos and pictures through a program called Made You Smile. They say a song can bring people together. Tonight, that may be more true than ever.
I appreciate this. I have 17 grandchildren.
You are my sunshine, my...
For kids and seniors, a ray of light in even the darkest times.
Stay healthy. Bye.
Kristen Dahlgren, NBC News, New York.
Well, they made me smile, and we certainly appreciate them. And a note tomorrow on Today, Savannah Guthrie interviews Fed Chairman Jerome Powell. That's Nightly News. I'm Lester Holt. Thank you for watching. Please take care of yourself and each other. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.